Hello everyone. My name is Jennifer Rono. I'm your host and welcome to my podcast Resistant Files, a podcast where we explore antibiotic resistance. I'm excited to have you join me in this journey, whether you're a student, healthcare professional, or simply someone curious about how medicine keeps us healthy. So what exactly is antibiotic resistance? When most people hear the word antibiotics, they think of a medicine that cures infections. For decades, antibiotics have been among the greatest medical discoveries in history. They have saved millions of lives by treating bacterial infections that once claimed countless people. But today, we are facing a growing problem. The bacteria that antibiotics are designed to kill are changing. They are adapting, then they are becoming strong. As a result, some antibiotics no longer work the way once they did. This phenomenon is known as antibiotic resistance. Okay, now let's imagine a bacteria as tiny invaders. When antibiotics attack them, most bacteria die. However, a few may naturally possess traits that help them to survive. So, over time, the antibiotics that once killed them become less effective or even completely ineffective. Scientists sometimes call them this resistance bacteria superbugs because they survive multiple antibiotics that previously worked. So, for example, many people take antibiotics when they are a cold or flu. The problem is that cold and flu they are caused by viruses, not bacteria. So, when taking antibiotics, they aren't needed. It only exposes bacteria living in our bodies to this medicine, giving them opportunities to evolve resistance. So, another common mistake. So, imagine a doctor prescribes you antibiotics for 7 days, but after 3 days, you begin feeling much better, so you decide to stop taking them. Although many bacteria have already died, some are still alive. The remaining bacteria are often the strongest survivors. They continue multiplying, increasing the likelihood that future infections will be harder to treat. So, sharing antibiotics with friends, family is another risk practice. Every bacterial infection is different. The type of antibiotic, the dose, and the treatment duration should be determined by the healthcare professional. In some countries, Antibiotics have been widely used to help livestock grow faster or prevent disease in healthy animals. And this may improve production in the short term. It also encourages resistant bacteria to develop. This bacteria can spread through food, water, animals, environment. So human health, animal health, and environmental health are deeply connected, and the consequences are serious. So, simple infections that were once easy to cure may require stronger medicines, longer hospital stays, or more expensive treatments. Cancer patients receiving chemotherapy rely on effective antibiotics because the immune system are often weakened. Even childbirth could become more dangerous if infections cannot be treated effectively. Okay, so according to global health experts, antibiotic resistance is already responsible for millions of deaths worldwide. The encouraging news is that everyone is or everyone contributes to slowing antibiotic resistance. First, only use antibiotics when prescribed by a qualified healthcare provider. Second, always complete full course exactly as directed. Third, never share antibiotics or use leftover medication. Fourth, practice good hygiene, regular hand washing, and prevent infections before they occur. Finally, keep vaccinations out of date. Preventing infection reduces the need for antibiotics in the third place. So, through this season, we will explore fascinating stories from history, hear about scientific discoveries, example how resistant bacteria spread, and discuss practical ways communities and individuals can protect the effectiveness of antibiotics. We will also look at what researchers are doing to discover new medicines and why responsible antibiotics use matters now more than ever. Antibiotic resistance may seem like a distant scientific problem, but it affects family, hospital, and every country. So that was my first episode of Resistance Files. So we will proceed to episode 2. So in episode 2 we will cover how antibiotics change the world. So it's hard to imagine life without antibiotics. Today, if someone develops a bacterial infection, we expect doctors to prescribe medication that will help them recover. But less than a century ago, even a smaller cut on a finger or a routine childbirth could become life-threatening. Before antibiotics, bacterial infections were among the leading cause of death. Diseases such as pneumonia, tuberculosis, meningitis, infected wounds claimed millions of lives every year. Doctors had very few treatment options. They could clean wounds, perform surgery, or try traditional remedies. But once bacteria spread through the body, there was little they could do. So people would live in constant fear that a simple infection would become fatal. So imagine you're a parent in the 1900s or in the 19th century. Your child develops a sore throat. Today, if it's caused by bacteria, and antibiotics can usually treat it effectively, but then illnesses such as scarlet fever, bacterial pneumonia often had devastating outcomes. Medical sciences desperately needed a breakthrough. So a Scottish scientist named Alexander Fleming was working in his lab at St Mary's Hospital in London. While studying bacteria, he noticed something unusual. One of these laboratory dishes had accidentally become contaminated with mold. Instead of throwing it away, Fleming looked closely and made an extraordinary observation. So around the mold, the bacteria had stopped growing. The mold was producing a substance that killed bacteria, and its name was penicillin. It was known as penicillin. So, many other more researchers discovered many other antibiotics such as streptomycin, tetracycline, erythromycin, and later cephalosporins. So thank you for listening.